LINX is a promising new development in the surgical management of reflux disease. It's a keyhole procedure whereby a magnetic ring of beads made of titanium is placed at the lower end of the gullet, where the sphincter is meant to be. Usually in patients who have reflux disease, their sphincter is weak. So what this bead does, it strengthens this muscle and prevents acid and food from regurgitating into the gullet and protecting it from damage. This procedure is meant for patients who have very severe reflux, heartburn and regurgitation, and in whom this disease affects their lifestyle, particularly their inability to sleep at night, and many of them, they sleep on elevated pillows, and even though they've been taking medication such as PPIs over a long time, we find that these patients don't respond as well. Some of them have side effects to the medication, and some of them are also worried about the long-term effects of PPI medication. So these are the patients in whom this treatment is quite effective. And basically, it's a mechanical device, and I've got a sample here just to show you how it works. So this is a magnetic device. You can see it opens and closes. And this lies at the bottom of the gullet. So when food goes in, it opens up like that. And when after that, it closes because of the magnets and prevents from acid going up into the gullet. If I can show you this sample device. And so we have got quite a lot of experience with this procedure over the past 8 years. We've carried out more than 140 procedures in total. And we recently conducted a survey, and we found that 86% of the patients were either satisfied or very satisfied with the outcome. And 91% were able to stop their medication or reduce them significantly by more than 50%. So we think in our hands, this procedure is very effective. In the past, we used to do the Nissen fundoplication, but with this, we're getting equally, if not, we're getting better results, if not equal results with this procedure. Technically, it's a very straightforward procedure, less invasive. And the most important factor is that it maintains the shape of the stomach, so we don't distort anything. The dissection is minimal, and we found out that it has lesser side effects than the traditional operation in the sense that it has lesser of bloating and dysphagia. And because it acts like an artificial sphincter, it allows the patient to vomit and burp if they need to. With the previous operation, that was quite difficult because that was a one-way valve. So this has an added advantage. As I have mentioned to you, it is quite safe. And if for any chance there is a need, either due to a complication or a side effect, it can be reversed by removing this device laparoscopically. We think that it is going to last lifelong because it doesn't involve any suturing. And the device lies in a fixed position. It doesn't move. So we think that once you've had a good outcome, there's no reason why this should not last for a very long time. And once again, in our practice in the past 8 to 10 years, we found that we have had very few cases of recurrence. As you'll appreciate that this is an implant and it's a foreign body which is placed in the body. So there's always a concern when you place an implant in the body, whether it will migrate or erode. So this is something we always warn the patients. But fortunately, once again, in our practice, we've had no such event. And so we think that it is quite safe. There is, however, one side effect of dysphagia, which does occur in almost all patients, and we do warn them. It starts at about 6 weeks and resolves within 3 months. But this is just the time when there's some amount of scarring and the scarring heals and the dysphagia becomes better. But that is the only side effect that one has to inform the patient. But once again, it's quite safe and it is effective. And if things do not work out, it can be removed. So we think LINX is a way forward for management of reflux disease, surgical management of reflux disease in the future. Thank you.